astronomical. So if you look at, if you can see my screen yet.
Not yet, but.
Not yet. Okay. So in the United States, yesterday, we had 1,083 deaths. We had 688,000 people that recovered from the coronavirus. We've had a total of 1.9 million cases of coronavirus in this country. Now we have exceeded everywhere in the world. Can you see it?
Not yet.
No. Oh, I'm so sorry.
That's okay.
Yeah. Okay.
Like I said, it's this
all right. When you drill in, we're coming from double digits, thousands dying of the coronavirus in the United States. So this represents a significant decrease in the numbers. The next highest country right now is Brazil, and I'm so sorry that everything's going so slow, but is Brazil. And when you drill into New Jersey and New York, when you break down the numbers, New Jersey had 123 deaths yesterday from coronavirus, and New York had 86. So these numbers are cutting way down from 900 over 1,000. I'm sorry, from 400, 500. In New York had sometimes over 800 and 900 people dying a day at the peak of this virus. So these are numbers that we don't want to see again. And at this particular, can you see anything yet?
Yes.
Oh,
yes.
You can. Okay, great. And when you drill into this, you can actually drill into New Jersey by county so that you can see what's going on in your county. And these numbers are posted every day. I always look at yesterday, just so you get a full 24 hours. So I go to this tab and go to yesterday, and then you can see by county where the deaths were, how many active cases, and I really keep a tab on how many new cases. And you can see that in every county, we're still having numbers of significant numbers of cases, not like they were, but certainly if you still have 60 people in Camden that were coming in and diagnosed, these are viruses still in our community. And that's probably one of the most challenging is that we have to understand that this coronavirus, I'm gonna reshare now my presentation, is almost like a cold virus. It is actually one of 7 coronaviruses, and we have to understand that it's in our community now, similar to okay, sorry. I love these hiccups. This is
I do too, but that doesn't let us.
I know. It
doesn't stop. It doesn't stop.
It doesn't stop. So you hear the words COVID-19. Am I sharing my screen?
No, not yet.
All right. I love this. I literally have had every technological challenge from WebExes that are possible. I persist because I definitely want you to see. Okay. How about now? No?
Oh, yes.
Oh, okay, great. Okay, perfect. So we talked about, so the COVID-19 just stands for the coronavirus disease. And it's 2019 because that's the year it was discovered. This talk is going to be framed around adaptability, brilliance, and consciousness, because these are the things, that the skills I think it's really important for us as a community, as a humanity, to understand how to adapt and live now that we have this in our lives. Just to go over some of the terms, we've heard a lot about, social distancing, and I want to stress that it is important, and it's important as even as things reopen, that social distancing be understood, because the basic premise is that the way that people survive this virus and the people that have done best are people who are healthy. But those who are not, or those who have are asymptomatic and shedding this virus, it's a droplet virus. So they found that if you're shouting or singing, it can certainly travel. But in normal everyday contact, remaining approximately 6 feet, a little bit more sometimes, is important to avoid contamination. So we're going to talk we'll talk more about that. The other thing that's going to be important, because we're not going to stop seeing this word, is quarantine. So recognizing that the way that you prevent the spread is to certainly isolate and make sure that we don't continue to contaminate other people. I want to make this a conversation. So if anybody at any time has a question, I don't have a problem stopping and answering your question. It's an intimate group. I'm certainly happy to focus on the area that's important to you. What do we know about coronaviruses? Some of them it is not new, and certainly China and other countries have dealt with contagious diseases. Why is coronavirus, COVID-19, a game changer? Certainly, if you have the flu, you're not going to be asymptomatic. Usually within 1 or 2 days of contracting the flu virus, you're going to feel unwell. And that's what makes coronavirus one of the most significant game changer, because you can have coronavirus and be asymptomatic for 5 to 14 days without, and you're during that time shedding the virus and not be symptomatic. So unlike other, they've even identified that there have been children who, they've had some cases in New York. However, those kids develop a very high fever for a very prolonged time. They have an automatic systemic reaction. This virus can be in the community undetected for a long time before it makes people sick. So it is a game changer. I should mention that SARS was a similar disease, but it was a respiratory disease in China. You can never control your phone. The thing about SARS, again, it didn't have this long undetectable time. So people in China were dealing with severe acute respiratory syndrome, SARS, before COVID, and it is also contagious, but you would have people get sick quickly. So recognizing this is what makes this very, very much, it's changed our whole world. You see, it shut down Disney. Is this presentation blocked for you? Do you have, you can see it, right? Can you hear me?
I was just on mute.
Oh, okay. I just didn't know.
No, it's fine. And welcome those of you who have joined us. Thank you.
Hi.
And if you can mute yourselves while we're on this presentation, that would help. Thank you so much.
Sure. One of the things I had the privilege of doing while I was at the hospital, because I'm a nurse and I'm responsible for patient safety, so I was literally in the hospital every day. But one of the things that happened during this outbreak was actual frontline people getting sick. Actually, the first person in our hospital that developed the virus was a physician. And so the symptoms were very classic. I probably heard these symptoms 1,000 times. People complained that they had fever, cough, shortness of breath, muscle aches, diarrhea. They had a loss of taste and smell. They just felt fatigued. And again, it could have been up to 14 days post-exposure that they began to exhibit the symptoms. I'm going to say that because I'm in a hospital, I've seen every gamut. I've seen people who tested positive, because we're also doing research study at the hospital, and had absolutely no symptoms. And I've seen people that have been hospitalized unto death. So the gamut of how the symptoms present really depends on the host. We talked about how it's spread, and it's through droplet, usually from close contact. People get infected, and it's important to know that it enters through your nose, your mouth. These are what it cannot harm you. If you just touch the COVID virus, it's not going to harm you. That's why, you probably wonder why they keep stressing hand washing so intently. It's because if you can disintegrate it, because it's not a bacteria, it's not alive. It's essentially a virus. It has a protein outside, which is how it kind of flies under the radar in some people who are immunocompromised. So your body doesn't recognize it right away as something that it needs to fight. So hand washing, disintegrating the virus, cleaning and cleaning surfaces is how you can put it at bay. Adaptability, and I stress this because we have to adapt as humanity in order to be able to stay well and fight this virus. So one of the things I'm going to say, and I'm going to stress this again, 80% of the people so far, this is our number, 80% of the people who contract the virus recover from it. And that number might even be larger because we don't know how many people have it. Many more people, and I know personally people who've had it who were never tested. So the whole testing conversation needs to be understood. So going in through your nose, your mouth, when it gets into the lungs and replicates, this is when it causes a lot of damage. So that's why, as we're wearing masks and as we're adapting to this new normal, we want to be mindful that if your mask has coronavirus on the outside, this is not the part you want to be touching. You don't want to be touching your face. You don't want to be touching the things that you're drinking and then touching your face because you're essentially ingesting it. It goes into your esophagus, no harm, no foul. But if it goes into your lungs, this is when it can really harm us. So what's the new normal look like for us? I mean, you've gone to the supermarkets, you've seen everybody is masking. It's going to be a part of our life. So I know that Governor Murphy shared today that New Jersey is going to have a process, a staged approach to reopening. And even when you say reopening, it's similar. I think back to before 9/11, I used to be able to go to the airport. My mom bought a ticket for a trip. She didn't want to go. I would just go. Here's the ticket. It's paid for. They're like, okay, we changed the name, and then we're done. That is no longer the case. If I don't have my name spelled exactly right on my passport, they're not letting me on a plane. So our new normal are going to have those kinds of drastic changes. How are we going to test? How are we going to identify and separate people who might have the virus? So I had the opportunity to travel to South Carolina a couple weeks ago, and they have less people with the virus in their community. So they're around stage 2, I want to say, so that you could dine in a restaurant. However, the restaurants are opening at 50% capacity. They don't have tables that are right next to each other. People who are in stores, they can be unmasked, but the people who are working in the stores, people who are serving food are all masked. So you'll see, and every business needs to understand what the restrictions are for that business. And we can talk about that a little bit later. Again, everything is going to be done based on risk. And when you're looking at quarantine, and this is just a public health notice that was put out, everything is based on risk. I'll give you the example in the hospital. If I had a nurse who was in full PPE, meaning that she was in masks, she had on the gowns when she was taking care of the patient, and the patient had COVID, there was almost zero transmission of COVID from that patient to the nurse. However, if I had people who lived in a house where they had a relative that had contracted COVID, and they shared the same bathroom, all the same surfaces, they are extremely high risk. So the health departments are going to have a big role in determining, based on our exposure, what needs to happen to be able to minimize this virus. And we're not used to that because basically a health department can tell you, you must quarantine, you must isolate. In South Carolina, they've given the police authority to shut down a business if they are not following the correct guidelines according to the municipality that issued them. So recognizing that there are going to be a lot of rules to the new normal depending upon the risk in your business. Anybody want to ask a question?
I would like for you, if you can talk about in terms of our children getting Kawasaki.
Sure. So Kawasaki is something that when I first, I'm going to tell you, I think I put a disclaimer at the beginning of this presentation, that this was created June 6th, because literally, and I'll show you on the next slide, as I've been giving education about Corona, something has changed every single week. So when I first started educating folks, my staff and my team, they were petrified. I don't want to take this home to my children. When we looked at all the data of what was happening in China, children were they might carry the disease, but they absolutely did not have a significant health impact from the disease. They didn't have a lot of symptoms. Now they tested positive for COVID, but they didn't get sick. They certainly weren't dying at the rates that adults and certainly people who are immunocompromised. But that's has changed with this iteration of virus. So now they've identified in New York where children that have tested positive for COVID have exhibited these Kawasaki-like symptoms. And the good thing about it is that they do elicit fever. So my cousin lives in Singapore, and every single childcare center takes the children's temperature twice a day as a routine. You don't, so there has to be a recognition that children do elicit a fever, and certainly as having a sick child and separating them out and making sure that they're attended to promptly is a part of the new normal going forward, especially when you have young children. And that's not something that we've ever had to do. The other thing is attention to hygiene and the amount of times that we would need to wipe surfaces and wash hands and just have that be a part of our routine day is probably something that definitely something that childcare centers are going to have to be focused on. Even when I talked to the restaurant owners, they were like, this is a lot of work. It's a lot of work making sure that every time somebody touches the back of a chair or customers leave a table, that surfaces are wiped out. And so similarly in childcare centers, there's going to have to be a lot of attention to the things that children touch and the surfaces and how we can best provide that hygiene on a regular basis to minimize. Did that answer your question?
Yes, it does. I have just another quick question.
Sure.
Not quick, but can we be reinfected?
Great question.
Infect ourselves even after being tested negative?
So there has been, the jury's still out, and I've heard a lot of, I've seen some data. There have been people who have tested positive for COVID, had 2 negative tests, and then retested positive for COVID. I'm going to tell you that just as a nurse, this is a cold virus. And how many of us have had a cold more than once? So recognizing that if it's not a virus like chickenpox, you're pretty much one and done. Once you had it, you built up these antibodies and you have these antibodies for life. We do not have data that says the antibodies keep you protected for life on this. That's why participation in trials, I'm in a trial right now. If you've ever had COVID, certainly recognizing that this needs to be studied because we don't have the information that, we won't ever get this again. And that's why all of the experts keep talking about, flu season is coming, and certainly this virus can raise its head again like a common flu. And we've had the flu in our communities for years, and even with the flu, there are multiple strains of the flu, and there are multiple strains of this virus. So I would just say I wouldn't put my hat on it because of the type of virus that it is. It's once you get immunity, you're done. They do say that once you get immunity, while you have the antibodies, and that's why antibody testing is going to be important, that you don't get it again. And they've definitely seen some good things happen when they gave the antibodies or the plasma of people who had COVID to people who were fighting it. They did the preliminary research really showed that there's a positive thing to having the antibodies in the system to help them. But the most important thing that helps people get better from COVID is their own immune system fighting this. All right. So I had to let you know that everything changes. So when I first started doing this, they were saying, don't go to work when you're sick, and that's going to be critical. And when we talk about, communities of color and disparities and who can afford to stay home when they're sick routinely, if in many occupations, if you don't go to work, you don't get paid. So recognizing that healthcare is going to be a part of a conversation, sick care, making sure that people are not impoverished because they're trying to protect the rest of us. So staying healthy involved not touching your eyes, nose, and mouth. That's still the case. The recommendation back then was not to use face masks, but certainly we realized that it was especially in New Jersey and New York, pretty much public use of face masks is really recommended. And I'm going to tell you from personal experience, the worst outcomes that I've seen are for people who are terrified of getting this disease. And I don't know how to quell that, or to, because everybody sort of, the beginning of the virus, the panic, sorry, that was in New York in the hospital was real. And because I was talking to patients, sorry, I'm getting a little dry, sorry about that, on a daily basis, yeah, some of the poor outcomes were people who were terrified. So this panic does not serve us physically. It doesn't, does not help. So I want to stress that. So our new normal is going to involve all kinds of rules around all kinds of things. And this is just one example that the CDC put out for public pool use. You know, it's getting warm. I know I'm finding it very difficult to stay masked. Is the heat. I don't know if it's my own personal summers that I'm having, or just the fact that it's getting warmer outside and the mask does keep you warm. So, you know, going to the beach and going to pools is going to be something that people want to do. But in South Carolina, they actually removed all the lawn chairs. If you want to go to the pool, you got to bring your own chair, because nobody is going to be assigned to wiping down all the lawn. You know what I'm saying? So we just have to kind of be strategic and be smart about how we are operating and do things a little bit differently. You know, still no crowds, making sure that when you use restrooms, they're putting up splash guards, trying to make sure that frequent cleaning is happening, and that even if you're swimming, that you're being mindful of keeping distance from other people. CDC puts out lots of guidance, and you'll see now there's all kinds of social distancing markings on the floors when you go to different markets, because they want people to be conscious about maintaining distances. What's kind of going on in the world right now and all of the protests, I just implore. I mean, these are a lot of young people, but people still need to be mindful that this virus is very real and very, very present. So, hand washing, masks, making sure that they're protected is important. The game changer also is that this was an animal to human transmission. So the probability of it just disappearing from the community is probably rare. And this is, it's important for folks to know that. I mentioned brilliance because I think I've seen some of the most creative ideas, most just innovative things come out of people having to adapt and survive in this pandemic. So just recognizing that no one has been through this before, and it has certainly been a game changer. I never thought that I would have my aunt passed away, and I would never thought that I would do a Zoom funeral, right? But we had 80 of us. She passed away in England, and we, celebrated her life through Zoom, recognizing that when you go to a funeral, it's one person at a time. This is a cultural change for us, because we're, like many cultures, very banding together during those tragic times. So being able to still kind of support your family and be present in an electronic way is just something I would never have even thought of, but I experienced it myself. So I wanted to look at the numbers, because I think it's important for us to understand when we're talking about disparities and how did this information come to us and what is happening. So when you look at the characteristics of people that are hospitalized with COVID by race, right? So you have African American being 33% of the hospitalizations. You have Caucasians being 45% of the hospitalizations. And the one thing that I did see was there were significantly more men that were hospitalized and had mortality from COVID than women. People with underlying health conditions. And I can't, but this bar shows you that over 80% of the people who were hospitalized with COVID were people who had other health conditions, whether it be diabetes, heart disease, they were immunocompromised in some way. It was a very, very small percentage of healthy people. And when we looked at populations, when you looked at like people who got it in the service, and yeah, there were large numbers, but when you looked at their mortality rates, it was significant. We talked a little bit about how it can be prevented. It's all about dissolving and destroying the virus before it gets in your system. When we talk about disparities, we say, oh, well, okay, why can't, we know the rules. Why don't we just have everybody, hand hygiene and social distance and just all the things that will keep us safe. And when you look at the barriers in certain communities, this cartoon sort of gives you the idea that, yeah, if you're homeless, where are you washing your hands? If you live in a very small apartment with, an entire family of people, how do you quarantine yourself when you're sharing a bathroom? And I did figure out why toilet paper was scarce. And, but, there's things that have to be purchased so that you can stay safe. And in many communities, these are not options. So we have to be very aware of what our community needs. We have, I was just looking at our mental health population. And so we want, we have services for mental health patients, and we certainly want them to be safe and have masks. But there's a lot of considerations that you have to have when you have somebody with mental illness. You can't have the masks that have the strings because, you've got to think about, if they're depressed and potential aids to suicide. So you have to be very strategic about how to keep vulnerable populations safe without in the midst of the virus, because I keep saying that my paranoids are like, see, I told you. But paranoia is a real mental illness, and now with all of the challenges, they're even more challenging. So making sure that, and this comes up with this whole protesting thing, that there's a plan around mass gatherings, and people need to understand. I think this is not even until phase 3 because they don't know how they can do it safely, consistently. So they're really trying to get up testing and make sure that there's enough support around, even if you have a big arena and then you find out that somebody there, how am I going to minimize the spread in the community by notifying this group that they have been exposed. So there's a lot of considerations from a public health perspective. The one thing I want to mention that a lot of places are opening, and they're not necessarily opening because it's the best thing from a public health perspective. The opening is very clearly an economic perspective, and some people's lives are going to be at the expense. So it's really important for communities to understand how to keep themselves safe, because it's not somebody else that's trying to keep you safe. If I can be blunt. So we talked about household, the things that we have to do. We talked about how what's happening with childcare and making sure that you're prepared before you open a service, that you are recognizing how you can protect the people that access your service. I'm very appreciative when I go to certain stores and I see, okay, I've got to touch the credit card machine, and then they have hand sanitizer there, because that's good. We don't have to go overboard and put on a Tyvek suit and gloves if we just hand sanitize. It's really important that we, if you have children, you have a thermometer. That's going to be a responsible, because I'm a nurse, I didn't always, I did the chin thing as far as taking temperatures, but you need to have a thermometer when it comes to, providing care for children. Businesses, there's probably not as relevant here, but just recognizing that there has to be a plan and there has to be consistency. We talked about cleaning, panic and reducing your anxiety. I did mention that, how important that is to, and this is my stress, right? The greatest gift that you can give your family and the world is a healthy you. And that's because that is the most significant armor. I mean, I don't know how many vaccines are going to have to come up with to really make a super impact. But if you can be healthy, there's hundreds and thousands of people who have survived COVID and they have lived to tell about it. Consciousness is really important because you don't even realize how many places your hands touches, how many surfaces we touch in a day. I go to the supermarket, everybody seems to be really clear about that. They have their gloves on when they're riding pushing the cart, but then they grab their cell phone with those same gloves. What's on that surface can be on your cell phone. So we have to have a consciousness around that. We talked about schools, watching and having a plan. What can you do now? I'm big on this, right? Recognizing that if you already come with a compromised lungs, if you have ever considered quitting smoking, this is a good time to do it because you do not need to have compromised lungs if you're trying to fight this virus. Real foods, real fruits and vegetables, really important. This is not the time to, eat the things that you get in the middle of the supermarket. I always say that if you shop around the edge of the supermarket, we're going to be a lot healthier because those things require refrigeration and they're real food. Maintaining a healthy weight. So this is a big challenge for me because COVID-19 is real. I keep saying that my button is socially distancing from my button boot on my pants. Like we're just eating because for many of us, when you come home, that's all you can do. But it's going to be really important to be conscious about, drinking alcohol in moderation. All these are challenges, but we don't want a lot of people are using, whether it be illicit drugs or alcohol or, smoking a lot more to deal with the anxiety. And you do not want your coping mechanism to cause you other problems down the line. Can't tell you how important it is to get adequate sleep and to avoid other infections. At the beginning of the pandemic, people were saying, oh, if it's anything, if it's a flu, if it's, some other infection, we're not going to even test for COVID. But certainly recognizing people can be co-infected. And that's how some of the people that really did poorly in hospitals, they ended up getting a pneumonia, getting a significant, infection. And those are the things that took them out. And we talked about how important it is to wash your hands. Cooking meat thoroughly is just something you should generally do because, again, if it's not cooked well, you could pick up something. And this is always the easy thing to do. Minimize your stress whenever possible, right? Very difficult for us to do.
Okay.
Right. Yes. You're muted again. I can't hear you.
I am an asthmatic and I use a nebulizer. And what I realized that, using a nebulizer, there's a lot of steam that comes out. So what I've done, I go in another room to give myself a treatment. I'm just so afraid, I'm home with my husband and my daughter just recently graduated. She's a doctor now. And thank you. She'll be a resident. Thank you so much. She'll be a resident at a New York hospital. And I'm so afraid being an asthmatic and using a nebulizer that it can cause problems for my husband and myself. And while she's here, she starts her residency in June 17th. That could be a problem. Am I correct?
It would only be a problem if you're COVID positive, right? So as long as, and that's why I would recommend that people who have concerns like that you get tested and see, because I went and got tested, not because I had any symptoms, but certainly I recognize my mom's up in age and I want to know if I'm one of those asymptomatic carriers. Recognizing that when you get tested, it's as good as the day you got tested, right? So if you get tested and then you come home, when you work from home, you're good. The thing about nebulizers, and I think it's important, not so much for somebody who's COVID negative, but certainly if a person is COVID positive, it's very important to be aware that you're right. Nebulizers aerosolize things. And so it would pose a risk to people who are in the home because they would be exposed to virus that's being aerosolized. And that's why in the hospital, we're very conscious of when patients are getting treatments or they're on ventilators, we wear a specialized mask. It's called an N95 that would prevent any of those aerosolized droplets from getting into our lungs. But the N95 is in very specific situations. In a home, going to the supermarket, those kind of things, it's overkill. And it hasn't been studied that people have been in an N95 for 12 and 14 hours. It's not natural to just keep breathing that CO2 in. So thank you for bringing that point. I think it's aerosolization is important if you're COVID positive, especially because some of the treatments, some of the things that help people who are recovering feel better are things like nebulizer treatment. So recognizing if you're in a house, you wouldn't want, and most doctors are not going to prescribe it because it can cause spread. If you're by yourself, then it's another deal. Any other questions? No. All right. Sorry, I'm going backwards. And he actually gave some wearing masks in public. And so it doesn't have to be an N95, a surgical mask. It can be a face covering, because the premise behind wearing face coverings in the community is for these asymptomatic carriers to minimize the spread to everybody else. So certainly if you are wearing a mask and you cough, none of the droplets are going to go into the atmosphere and cause harm to other people. Recognizing that it's not 100%, but it is certainly better. I saw the other day somebody that had to cough and they pulled down their mask, coughed, and then put the mask back up. Clearly not a good understanding of exactly why they're wearing the mask. Or I'll see folks wearing the mask with a vent. So if you're trying to protect other people from you, having a vent where air goes out, but things don't go in, is not going to protect other people in the community. So if I'm in an elevator, with somebody with that vent on, I better have my mask on. So masks can be simple. Consciousness, I stress again, because it's something that we need to be mindful of the surfaces. But I don't touch the presentation. There is one state where COVID-19 does not exist. Anyone know what that is?
Iceland?
The state of denial.
Sorry, you said a state?
State. Mm-hmm.
Okay.
Yeah, it's the state of
Kentucky?
No, actually every state in the United States, except the state of denial, has COVID-19, has had a case.
Interesting, the state of denial.
So I put this up to show you that it is literally across the world, right? There it is. So when you look at, China and the size, there are areas that are not as impacted as the United States. And a lot of this was attributed to air travel. So Brazil now has numbers that are at times exceeding ours, but they have not shut down. So I'm watching Brazil very carefully, because it's going to, the impact of what they're going through now is significant.
Can you please mute your mic? I hear some people's, if you can mute your mic. Okay, thank you.
So some of the controversy has been around the disproportionate death of African Americans in certain states based on their presence in the population. And so you can see that African American deaths in the darker blue states, we're still only 14% of the population, but in Georgia represented 31% of the deaths. In Maryland, represented 29, almost 30% of the deaths. So there are definitely hotspots where African American mortality was significantly higher than others. So just it's something to watch. Again, it's all about the total numbers, like how many people contracted it. But when we're looking at the information that we have about the number of people who have it and the proportion of African Americans that die with it in these states, it's significant. And you can see the lighter color, well, they're lesser in African American populations, but they also have lower mortality. Some of the stigma, and I haven't seen this, and I work in a very multicultural organization, but they are saying that there are some stigmatization that's happening to Asian Americans because of the historical beginnings of the outbreak. So we just want to be mindful that it impacts. As a matter of fact, at our hospital, we probably have had several people, and the 2 nurses that have died of the disease have been Asian. So I am sensitive to the fact that it impacts every person. It is not a respecter of persons. So they've done some studies, and 90%, and this I showed you on an earlier slide, 90% of the people in the hospital with COVID had at least one underlying health condition. 50% had high blood pressure, 48% were obese, 35% had chronic lung condition, 28% diabetes, and then the mortality rate being significantly higher than mortality for whites. Okay, sometimes it's delayed. So what are the reasons, or what are we seeing? Certainly we talked about lack of health services. I told you that if you are healthy and have healthier body, you certainly do better with this virus. So not being able to have access to health services is a significant thing. You know, being not having a culture where social distancing is a part of our culture. We do everything, you know, a lot of things in groups. That certainly impacts it. A lot of African Americans have service jobs, so you cannot work remotely when you're, you know, teaching small young children, or you're providing food, or you're, you know, doing a service job, cleaning houses. You're not able to social distance. So living conditions, we talked about that. And then having multiple comorbidities that are not managed. I can't tell you how many people I hear, oh, I know when my blood pressure is up, I get a headache. They call it the silent killer because it doesn't always, you know, we have strokes. So what can we do? So certainly we need to participate in clinical trials, you know, be as healthy as we can be. You know, when the testing comes out, it's going to be a matter of getting regularly tested so that we can operate in spaces where we're used to, so you're comfortable. We talked about the importance of those who've had it. Even if you had a mild case, you probably had antibodies. You know, donating convalescent plasma is something that you can do. And then this is, you know, healthcare for all, because I certainly recognize that people who are more vulnerable and more at risk will more likely put us all at risk because they cannot afford to stay home. Help someone else. Oops, sorry. You know, this is a slide that talks about equality, you know, equity and liberation. And when I look at this, I would just love to get your thoughts on what's depicted here. How many folks are here? Can anybody unmute?
I will say that this slide is often used. One of the slides says used a great deal with NJEA and in showing equality and what it looks like, especially when this person, you know, when people can't see over the fence, and if you have to be a certain height and hear how, when we talk about equity, how this child at the end is helped by adding boxes,
More resources.
more resources. And so when the walls are taken down, this is exactly what it looks like. And this is where we have to get to at this particular point in our lives. We have to advocate for ourselves. We have to be proactive in some of the things that we do, and also be supportive, with other people in mind. So thank you for this.
When I've used this slide in a lot of conversations because I do talk about disparities all the time. And as I was thinking about this in the context of COVID, there are some factions in our society that don't think that you should see the game at all. And we have to realize that our health and we want to be in the game. We want to see the game. We certainly want to have the rights to it, but everyone does not consider viewing the game a right. And it's ironic how people who made a lot of money from packing large stadiums this way, it's a game changer for them. They have not yet figured out how they're going to restore the resources that they made from all of these people being in the stands. Restore the revenue, I should say, the revenue that they made. So just being at the game is a whole different conversation now. That I think it's timely and it has to be had. And just some things, I think I gave you guys all of my tips. We're now preparing to get back into our new normal, but it is still, folks are still sort of mourning what they had. And so recognizing that you cannot 24/7 just consume COVID news or social media, that we have to get back to our humanity and make sure that we keep connections. Getting outdoors is important to sanity, to being able to connect with the universe and recognizing that, we've been inside quite a long time. And then I just encourage everyone to, create smart ideas for your sphere of influence. None of us have been through this before. And so the creativity and the brilliance and just what I'm seeing and how do we help each other as human beings is just let that flow. Exercise and meditation and doing what we need to be mentally and physically healthy, important. I talked about how important it is to eat nutritious, immune boosting foods. This might be a time for you to get a coach. A lot of times, we don't know what to do. And I want to stress that mental illness is like physical illness. It needs to be addressed and treated, and it can be treated and addressed successfully. Sometimes in communities, we don't have a respect for mental health, or we don't recognize how much it impacts us. But a lot of the shortness and the being easily triggered and a lot of different emotional things that are coming up for folks now are unresolved mental illness, unresolved anxiety, unresolved anger, which is really frustration. So recognizing that getting a coach, getting a therapist, getting someone to help you to get to a better place is important. I advocate for gratitude. I think COVID-19 has definitely given us a lot to be grateful for because there's a lot of people that are not here, but there are other things that have come out of it. And then to just stay positive, to remind yourself that you're going to get through it is critical. I would be remiss if I did not mention that there are people who are struggling with real needs. The unemployment rolls, the things that are happening as far as social service resources. 211 is a great resource. And there are services from, being able to have a list, living through a layoff, talking about how to not go into foreclosure if your, incomes has been changed. The United Way, being able to access unemployment. I can't tell you how many stories I've had of people who are not able to access unemployment are in need. So there are a lot of different links and they're in different states, but New Jersey 211 also has online resources, and then there's a phone as well.